Let's be honest for a second. When someone hears chemotherapy, the very first fear is usually nausea and vomiting. And that fear is real. And here is what I want you to know right away. This is not the 1980s anymore. Today, with modern medicine, vomiting is often preventable and nausea can be significantly reduced. In this video, I'm going to walk you through why chemo causes nausea, the 4 different types of nausea, how we prevent it before it starts, and what to do if it still happens. I'm Dr. Pachipala, who is board certified in hematology and oncology. I practice in the greater Houston area. So why does chemo cause nausea? Your body is very smart. It's designed to protect you from anything it thinks is toxic. Chemotherapy is powerful, so your body says, this might be dangerous. Let's get it out. This activates the vomiting center in the brain. Here is the simplified biology to explain in a flowchart. You get chemotherapy. Your gut releases serotonin. It triggers brain vomiting center, causes acute nausea, which happens in the first 24 hours after chemotherapy. And then the brain also releases substance P, which activates NK1 receptors responsible for delayed nausea, which happens on day 2 to 5. There's also dopamine and even your emotional brain involved. That's why nausea is not just physical, it is also psychological. There are 4 types of chemo-induced nausea. If you understand this, you understand how we treat it. Number 1, acute nausea. This is the nausea that happens in the first 24 hours, usually peaks around 5 to 6 hours, and this is the easiest to prevent. Number 2, delayed nausea. Happens on day 2 to day 5, often more difficult, very common with drugs such as cisplatin. Number 3, anticipatory nausea. This one surprises people. You feel nauseated before chemo even starts. This is triggered by smell of the clinic, seeing the chair, even thinking about chemo. This is a learned brain response. Number 4, breakthrough nausea. This happens despite medications to prevent nausea. Important point about this is not a failure. This is a feedback. We adjust medications accordingly. The key message is, if we control nausea completely in cycle 1, everything becomes easier after that. Prevention of nausea. This is where modern oncology shines. We don't wait for nausea. We prevent it before chemo starts. Typical prevention strategies like this. We assess chemo risk based on the chemotherapy regimen you are receiving. If it's a low-risk regimen, we give 1 medication to prevent nausea. If it's a moderate risk, we give you 2 medications. If it's a high risk of nausea with chemo, we do 3 to 4 medications. And then we continue these medications for 2 to 4 days after chemotherapy. So what are the main medications we use to prevent nausea? Let's break this down simply. Number 1, serotonin blockers. Examples include ondansetron, commonly known as Zofran. It blocks signals from the gut, best for early nausea. Number 2, NK1 blockers. Examples include aprepitant. It works in the brain, critical for preventing delayed nausea. Number 3, steroids such as dexamethasone. It boosts the effectiveness of everything else we are giving. Very important part of the combination of anti-nausea drugs you are receiving. Number 4, olanzapine. It's been used for psychiatric conditions, but it's also one of the most effective anti-nausea medications we use in clinical practice. So bottom line, when we combine these drugs correctly, most people do not vomit. Nausea is much more controlled than people expect. What is anticipatory nausea? This is basically about the mind-body connection. Somebody gets a bad nausea experience in the past, and the brain forms memory about that experience. Triggers such as smell, place, and thought of chemotherapy triggers nausea even before treatment. So how do we prevent this? Anticipatory nausea. You control nausea from the very first cycle properly so that you don't get anticipatory nausea from second cycle on. We reduce anxiety. Relaxation techniques, sometimes short-term medications may help. If we do it right early, this may never happen. So what if nausea still happens, what we call breakthrough nausea? If the patient calls me and says, "Doc, I'm still nauseated," we don't just add meds blindly. We ask, are you taking medications on a scheduled basis? Are you constipated, which can sometimes cause nausea? Are you dehydrated? Is there acid reflux? Is anxiety playing a role? Sometimes it's not just the chemo. We have to look at other things as well. So how does a breakthrough nausea plan looks like? If the nausea continues to be the problem, we tend to add medication, which is different from the classes of medications we had before. We add hydration, IV fluids, IV medication. We upgrade your nausea prevention medications for the next cycle. Important thing is we never repeat the same plan if that plan is not working for you. What are some of the practical tips, home tips for preventing nausea? So these support medications, they don't replace them. So one of the recommendations is you eat smart. Eat bananas, rice, applesauce, toast, what we call brat diet, B-R-A-T. Other good options, oatmeal, boiled potatoes, plain pasta, crackers. Add a light protein. For example, you can use scrambled eggs, boiled or baked chicken, yogurt if tolerated. Stay fully hydrated. Take clear soups, ginger tea, electrolyte drinks, small frequent sips. These are the things to avoid. Fried or greasy foods, strong smells, spicy food, heavy, creamy meals. What are some of the key habits? Inculcate small, frequent meals, room temperature food, take medications on time, and when to call your doctor. Don't wait. Call your doctor if you have, number 1, vomiting more than 3 to 4 times a day. Number 2, you can't keep fluids down. Number 3, dizziness that indicates dehydration. Number 4, no urination for 8 to 10 hours. Next, fast heart rate or severe weakness. When you have those symptoms, yearly hydration can prevent hospital visits. What's the take-home message here? Let me make this very clear. Nausea happens because of brain plus gut signals. There are 4 different types of nausea and we treat them differently. Prevention from cycle 1 is critical. Combination therapy works much better. If nausea happens, again, despite the medication, we adjust, not ignore. And most important, do not suffer in silence. So in conclusion, years ago, chemo nausea was one of the most feared parts of treatment. But today, it's far more controlled than most people expect. Is it perfect? Not yet. But with the right strategy, many patients go through chemo with minimal vomiting and manageable nausea. If this helped you or someone you care about, share it because knowledge reduces fear and prevention reduces suffering. I'll see you in the next video. Thank you.